Okay, hello everyone. Thanks for joining us. This is the Joint Information Center for Champaign County news briefing for Thursday, May 14th. We'll just get right to it today. We have Champaign-Urbana Public Health Administrator Julie Pride, who's going to give us some local updates.
Hi, good afternoon. We're reporting 11 new cases today for a total of 333 cases. We are also currently managing quite a few outbreaks, everything from a large outbreak with several hundred employees in place to about maybe 10 more with just a few cases at each location. We currently have around 500 people in quarantine and about 150 or so in isolation. I just want to remind everyone to, continue to do the things that you're doing. All of these outbreaks are in facilities that are able to be open, so they're all in workplaces of essential workers, and they are, it's important to know that when you're there, you need to continue to wear your masks, and you need to continue to do infection control measures. So the places that had really good infection control, you can always get a case in there, but with good infection control, it will not spread throughout your entire work site. So everybody that is working out there, please continue to do that. And remember that as much as you may like your coworkers, they could also be infectious. So maintain that 6-foot distance from each other as well. Thanks.
Okay, thanks, Julie. Next, we're going to go to Urbana Mayor Diane Marlin.
I just focusing on the governor's Restore Illinois plan. We're currently in phase 2 in our central Illinois region. I think we're moving toward phase 3, but as I caution everyone, it's going to be slow, it's going to be phased, and we're going to do it very carefully. And I always am cautioning people that reopening is not flipping on a switch. Things are going to be different, and underlying everything we do for the next months and maybe possibly years is going to depend on physical distancing, hand washing, sanitation in our workplace and in our place of business, and wearing face coverings in public to reduce the spread of the disease. And we are cautiously optimistic about the university's plans to bring in-person instruction back in the fall, and we're certainly working very closely with our community partners in that.
Okay, thank you, Mayor. And next we'll go to Champaign Mayor Deb Finan.
I want to focus today on the governor's plan as well, but the fact that, we are within an existing region, and that really, if you look at the regional numbers which are available at the state website, we are doing very well as a region. It's really important that we continue to be vigilant and that we continue to work together. There have been a lot of cries over the past week relating to wanting mayors to go it alone or cities to go it alone. And it's important for people to recognize when that happens, then that puts our entire region in jeopardy. And the regions were really determined based on available hospital beds within our region. So, not only is it important to keep Champaign-Urbana and Champaign County safe, but the work we are doing is helping our entire region. And so we continue to reach out and work with the other governmental entities within our region. We ask that our citizens continue to do the work that they have been doing. As Mayor Marlin said, physical distance, wash your hands, wear your mask. Within the next couple of weeks, we are hoping that we will be able to move into phase 3. And that really all depends on all of us continuing to be vigilant today.
Okay, thank you, Mayor Finan. So as we always do, I'm going to go down my list here and give you an opportunity to ask questions. We do have a little bit longer list today, and there are some usernames on it that I don't recognize, some phone numbers. So bear with me as I go down the list here. I'm going to call on everyone. I know some people here are from our partner agencies, so if you don't have a question, that's fine. Obviously, just let us know and we'll move on. And also, if you could address your question to a specific person, that always helps us as well. So I'm going to start at the top of the list. I've got Autumn Salomon.
Good afternoon. I do just have one quick question. I had read and understand that a lot of the employees who were tested at one of the outbreak sites were asymptomatic, but they were tested as a whole. I was wondering, with the new testing centers coming in, if there were any plans to expand the testing criteria to test essential workers, even if they're not symptomatic, so that we can see if there's community spread in those essential places.
For about 3 weeks now or so, we've had anyone who is currently working, wherever you're working, you're eligible to test even if you don't have symptoms. That guidance was expanded quite a while ago. So yes, anyone who is currently working, whether you're working in a grocery store or whether you're a newscaster or whether you're the mayor or anyone, you can go in and be tested. You just call 239-7877 and you'll get a code and you can go through testing.
Okay, thank you. Autumn, if you don't have another question, I've got Courtney Bunting next on my list.
Okay, thank you. I just had one really quick, and this might seem unrelated to what we talked about today. It's a follow-up on the situation with the gym in St. Joseph. And Julie, I guess I'll direct this question your way. It's just that, is a gym able to, or any business that opens up whenever they maybe have a cease and desist order or any kind of recommendation to not open up, can they get insurance if an employee gets hurt or someone going inside gets hurt or happens to get COVID? What's the situation there? Do you know?
That would be a question for, well, if somebody goes in there and gets sick while they're working there or while they're being there, I guess that would be a question for a trial lawyer. But the question, any questions related to that facility would need to be directed to the state's attorney's office. We did issue a cease and desist order. Gyms and facilities like that are not able to open until, well, in phase 3, they're able to have some outdoor classes and one-on-one training, but the gyms themselves will not be eligible to open until phase 4. So, if we end up getting outbreaks, that kind of pulls everyone back. So, yeah, so I would suggest that you direct that question to the state's attorney's office, kind of on what the next plans moving forward are.
Okay.
I would also mention that I believe it's Illinois Insurance Association, I might have that wrong, but Kevin Martin was quoted last week as saying that liability insurance would not be covered in those situations. So you may want to reach out to the trade organizations and talk with them.
Okay, that's the only question I had.
I told you to ask an attorney.
Okay, thanks, Courtney.
Thank you,
Deb
Julie.
Godig, I've got you next. Okay, hearing nothing from Deb, I'll go to Ethan Simmons.
Hey, so this is a question for Julie. So you talked about some of the outbreaks at those essential businesses. And so when you're talking about proper infection control for those that did not have, severe outbreaks, what does that look like? And where did some of those essential businesses sort of go wrong when they were trying to handle this?
Well, they didn't go wrong. That's the good thing. So far, the outbreaks have been contained. An outbreak of COVID-19 is 2 or more cases in any type of facility. And I always caution people, you cannot keep out one case, because anybody can get this and bring it into their, they can get sick from it doing something else. But once you get into your workplace, if they are doing the infection control measures, which I have to say a lot of businesses are doing an amazing job in this community of that, that would look like symptom checks. Some of them do temperature checks in the morning. They check for symptoms, and then wearing masks at all times when you're around, when you're in a facility and around people, and making sure that you maintain social distancing. I know that some of the outbreaks, not here, but in other places, have been caused by people doing pretty good infection control within the facility, but then they go outside for a break, or they go into the break room, or they go, you know, to the lunch together in the lunchroom. You have to remain vigilant the entire time you're around other people.
Thank you for that. Thanks for the clarification. And this is, oh, sorry. Does Deb have a question? Well, this is directed toward the mayors. I was wondering about, I heard that the libraries have opened up for curbside pickup recently. And so I'm wondering if there are any other sort of local institutions that you can see adapting to the pandemic to still offer services sometime soon.
Well, you're correct in that. I believe it's next week that the libraries will start offering curbside service. At least that's what, for Urbana Library, but I know it's going to be consistent with whatever Champaign does. So maybe it's this week. I'm not sure. But yes, they intend to do curbside delivery of books. They won't be getting books back until, in Urbana anyway, until they have determined what the safe way to have returned books and how to handle them. But yes, that's the next phase, is to do the curbside delivery. What we're doing in Urbana is right now reaching out to about 120 businesses. Staff members, including myself, are calling businesses to get a sense of where they are now, whether they're open, partially closed, or closed, what they think they'll need in order to transition to opening when the time comes, and what assistance they might need and what challenges they're facing. So we're getting a really good idea, I think, of the challenges that are going to be facing businesses going forward. One example of a transition to opening, but being open in a very different way is our Urbana's market at the square, the farmers market. The old model for the farmers market was it sold food, it sold artisan products, it was a social event, there was a very big social component, arts, performance, etc. The market has reopened with physical distancing, with crowd control, with face coverings, with sanitation, and it is a food-only market. So it's, if you will, it's kind of gone back to its roots. When it first opened was for food, a couple of other essential items. So each business, what I've discovered is each business is a story in itself, and each business is going to almost need a custom approach to how to open in a way that works for them and that keeps their employees and the customers safe.
The city of Champaign is also reaching out to businesses. We are actively engaged, as is Urbana, with a group that is being headed by the Economic Development Corporation and the Champaign County Chamber of Commerce, that is working to create sector plans in conjunction with CUPHD to be reviewed so that we can help businesses understand what things they will need to be doing in order to have safer processes as they reopen. But as far as, institutions reopening, I do want to give credit to Urbana, who worked incredibly hard to get the Landscape Recycling Center up and running, and institute new processes with no point of contact, right? So people are paying online and soil is being loaded into their trunks. But we are partners with Urbana, although Urbana manages that, and they've done an amazing job of getting that up and running.
And that was well, if you will, we came into the 21st century because we had been a cash-only operation, and within 2 weeks, we transitioned to accepting credit cards and no cash. So it's pushed us forward. This virus has pushed us forward in many ways.
Thank you. I have no further questions.
Okay, thanks, Ethan. Haiti, you are next on my list.
Thank you. So I have a few questions for Julie. Like you mentioned that Public Health District is managing several outbreaks. Can you share where exactly they are?
No, because we only share that information usually we share that information only if there's a need to know for the public, like there's a public health concern. And the other thing would be if that information has already been shared by the facility itself. But I will tell you that all of them appear at this time, knock wood, to be under control and very small.
Okay, and so at least you can say that they're just at essential businesses or anything like that?
Yeah, I mean, they're at places that are allowed to be open right now. So, and that's just sort of a cautionary tale for other places. I think that the next group that moves in and starts up in phase 3 will have a little more time to think about it. They'll have a little more time to learn from the other places that have already been open, like in manufacturing or even restaurants doing curbside service or anything like that. I think that they'll be able to learn from that, and it'll make it even safer. People seem to be really understanding the concept of this and moving it forward. And like I said, you can't prevent like one case getting in anywhere, but if you have good infection control, then maybe there's just going to be 1 or 2 people infected in the workplace and not tons of people infected in the workplace.
Okay, and when you say that an outbreak is considered if it's 2 or more cases, so wouldn't it make sense to put people either in isolation or quarantine immediately to, wouldn't that help stop the spread of the virus?
Yeah, and so let me tell you how that works. So if somebody tests positive, I just mean we don't like announce it to the media, because if it was something where we would need to, that would be one thing. But what we do is for every positive case we get, we investigate it. We talk to the positive case. We find out where they work, what their home, who they live with, who they've had contact with, which we hope is no one, because we're not supposed to be having contact with people outside of your home. And hopefully it's protected in your workplace. And then we put that person, the positive person, immediately goes into isolation, and anyone who is exposed, so that would be any close contact, those individuals would then be put into quarantine and offered testing. And if they, they're followed up by public health the whole time. That's why you see that's why I said that there's like 500 people, it's over 500 people currently being monitored in, they're in quarantine, and then another 150 or so in isolation. So the isolation are the active cases, and the quarantine are those that are exposed, that are either awaiting test results, or they, for whatever reason, chose not to test, but they have to remain in quarantine until their incubation period is over.
Okay, and then the management process, like you just mentioned, it doesn't matter the location of the outbreak, whether it's like at a meat plant or it's at a nursing home, it's all the same?
No. Each one, each setting is different. Everybody still is offered the testing. That's all the same. But we also, when there's any type of an outbreak, we also send staff out there to help, check practices and help brainstorm, how something might have happened. And that's how we know that a lot of times it's like somebody wasn't thinking and they went out on a break outside together, or they got in the car together and went somewhere. So that's how we know kind of how it moves around. But yeah.
And then my last question, so for it to no longer be considered an outbreak, everyone has to be recovered or out of isolation or out of quarantine? Yeah,
exactly. And you can also have more than one outbreak. So let's say that you have a facility, and I'll talk about the one that we had at the nursing home, for example. And the reason why those you usually find out about those is not because it's a public health risk to the community. It's usually because nursing homes or long-term care facilities are required to provide notification to all the family members up there, and someone almost always contacts the media. So once it's in the media, then, then we can talk about it. But so let's say that one of the long-term care facilities, a case got in there at Clark Lindsay, and there was no spread from that. So that was good. And then the other place, there ended up being a couple of cases in that one. I believe a total of 3 residents and 2 staff, and everybody tested, and so that's good to go now. However, so they were able to shut it down and not have it go all through the whole place. However, anyone can bring it in again. So that's why you have to keep maintaining vigilance all the time. Just because the workplace has had one outbreak, it can have another one if the infection control processes do not remain in place. Okay. And we've seen that across the country. There have been places that have had multiple outbreaks, and that is not good.
Gotcha. Last question, I'm sorry. And then just to be clear, you said that these outbreaks are contained, so the public shouldn't be concerned or anything like this about this?
Right. So again, if it was something where, and this is what helps with shutdown and everything, because these are closed, all of these things are closed systems. So we know everyone who is there. And we know, the processes. So we know that, if it was somebody at a store and we didn't know who was coming and going and everything, then we would probably have to announce that. But the way things are being done now, we know that it's contained. So all of these kind of bizarre things that are happening now, the shutdowns, the contact tracing, and the things that all limits the potential for an outbreak and danger to public in general. Now, again, if somebody gets sick and their job, they take it home, there's a very high likelihood that the people in their home are going to be exposed and infected, which is why it's really important that people with high risk, individuals in the home, stay away from those individuals or isolate or quarantine in another location. But the risk to the general public is going to be a much slower spread if we're not having any kind of group activities. Now, I saw on the news today and was horrified that Wisconsin, they just opened things up and the bars were packed. So what's going to happen there is there are going to be outbreaks. Anyone who got infected in those bars, no one's going to be able to track who all those people were. They're just going to start popping up sick all over the place and infecting their workplaces and their homes, and then those people in the homes are going to go infect other people. So that is when you get things out of control.
Thank you, Julie.
Welcome.
Okay, thank you, Haiti. And then Leisha Bushek, you are next on my list.
Hi, I'm Lesha with WILL. I have a couple questions for Julie and then also a few for the mayors. Julie, Carl said they would be validating antibody tests and that you'd be working with them to make a plan to scale up antibody testing across the county. Do you have any update on that?
Oh, I know that they've been testing staff. I know that McKinley's been testing people. So they are, the tests are good. The tests are validated, and they're actually doing them now. What we're looking at is how are we going to use that, community-wide. There's been all kinds of different plans laid out to start with, but I don't know exactly where that is right now. The thing that we need to make sure that people understand with the antibody testing is as long as you're getting serology or blood testing that goes to a laboratory, those tests are very, very good. They're very accurate. Some of the point of care ones where you stick your finger and then get test results in 15 minutes, those are not as accurate. But the ones that we'll be doing in our community are very accurate. But we need to make sure that people understand we do not know what that means. So if you get a test back and it says you have antibodies to COVID-19, that doesn't tell us if you're going to be able to get infected again, if you won't get infected again, if you know, having been infected once makes you at risk for a more negative outcome the second time. We just don't know that. But you can still test once it becomes available, and know you can have that piece of information for yourself. You can know that you have already been infected, but you should not change your personal behaviors based upon that until the science catches up with us and we know what that means. So that would mean you would know that you have had COVID already, but you still need to continue the social distancing and the wearing the mask and the hand washing and the sanitizing everything. So it won't change much as far as behavior, but it will be good for public health to have more of a sense of how many people have already been infected and may not have known it. And it will also be good information for the individuals to know. We just won't be able to act on it yet.
And do you have any update on the COVID testing site that will be opening at Champaign Mall next week?
I don't, but that should be coming out. That will be advertised by the Illinois Emergency Management Agency and the National Guard. So I think we should have something by the end of the week about that. Well, it is the end of the week, so probably tomorrow.
Okay, thanks. And I have a couple questions for the mayors, and I was kicked off the Zoom call for a second, so I apologize if this has already been asked in some way. Are either of you hearing from businesses who want to reopen sooner than the Restore Illinois plan is allowing for? At the Champaign County Board Committee of the Whole meeting this week, several Republican members spoke out in favor of earlier reopening. What do you think of those thoughts, and also of the faster plan for reopening that was announced by leaders in the 11-county heart of Illinois subregion, including Peoria and McLean counties?
So I hear regularly from business owners and the public who are concerned about the economic impact. And I certainly am sympathetic, particularly to the business owners, our small local business owners who are struggling, and their employees who are struggling during this time. As I said in my opening remarks, I believe that it is very important that we continue to comply together in order to maintain what we have been able to do, which is slow the spread and have available hospital beds. We are doing the right thing. We are very close to being at phase 3. If we continue to social distance, wash our hands, wear a mask, we, very likely can be in phase 3 at the beginning of June. And so I think it is important that we stay the course. I know that Champaign and Urbana, and the Urbana's mayor can speak to this herself, are committed to working together to make sure that we continue to maintain our community health. And, we are working with our business owners. We want to have a plan for reopening. We are trying to find creative ways for them to work within the system that we have, but we are going to comply with the governor's order.
I agree 100%.
Thank you.
Okay, thank you, Lesha. So that is the end of my list, so that'll conclude our Q&A session for today. One quick note for the media. Obviously, we do these every week, so if there's any local officials or local representatives that you'd like us to bring on, we want to make sure we're getting your questions answered. So let us know, and we'll do our best to make those connections. And then a couple of resources we always like to share. 211 is a service provided by the United Way of Champaign County. Anyone who needs assistance or needs help sorting through the local resources can call 211 to get hooked up with a trained specialist that can help them do that. And then lastly, local updates and local information are posted every day at champaigncountycovid19.org. So anyone watching who would like more information can head there for more information. That'll conclude our session for today. Thank you all very much for joining us.